Have a good one.
I think the needle exchange program is very good because the people that's on drugs, if they don't have clean needles, they can catch AIDS and spread diseases around.
You know, people that stick, they don't care how they shoot it or what they use. You know what I'm saying? That's why this truck is good. You know, it helps out a whole lot. You know what I'm saying? It helps out a whole lot.
The connection between AIDS and IV drug use is really the driving force between the spread of the epidemic in our city. And that is the reason also why we have so many women and children with the virus, or women and children with the disease, is because while addicts are primarily contracting and passing the virus through needle sharing, they're also passing the virus on to partners, sex partners, and children are being born infected as a consequence.
A needle exchange program does not increase the number of needles in circulation. What it does is it increases the turnaround, all right? So the actual length of time that any needle spends out there is now much less than it was before. As a consequence, the needles have a lower chance of getting infected, which is what you would hope to pick up in such a study, and also people using those needles would then have a lower chance of becoming infected precisely because they're exposed to a lower fraction of infected needles.
We knew that we had to get the message to addicts on the streets about how to protect themselves and how to protect others, and we also wanted to bring out bleach kits because at the time that's all that we could do to help people avoid passing the virus when they shared needles was to use bleach to destroy the virus. So we went out there armed with our bleach kits and our condoms and our AIDS information packets. And in the process, we really learned a lot from the voice of addicts about why they continued to share. What they told us is they shared because they were afraid of being arrested. They shared because they were afraid of criminal penalty. It was really the Mayor's Task Force on AIDS in New Haven that led the fight. That included decriminalizing the sale and possession of needles and syringes without prescription in Connecticut, as well as starting needle exchange programs. It also included aggressive education and outreach and expansion of drug treatment services.
Give you any hassles, you give us a call.
Okay.
All right?
Initially, the officers were hard-pressed to understand why we would be dealing with these heretofore quote-unquote criminals in this type of fashion. And then when you start to explain to them that it's not just handing out needles to stop the spread of AIDS, but it's also to make a medical contact so we can facilitate some, or if not all of these people into drug treatment facilities. You start getting people to buy into it, and you start to develop what I call that social sense. It's part of social engineering. I'm a strong believer that the meaner the policing, the meaner your streets will be.
What's the code name?
Roadrunner.
Roadrunner?
Yeah.
How many we got?
2.
Give your dirty ones to a Chris.
Roadrunner
2. There's bleach, condoms, whatever you need. The normal procedure for a client who's already enrolled is for them to give Chris their dirty needles and to come to me, give me their code name, and for me to chart on them and to give them the clean needles.
What I put here is today's date, the area, and their code name. I attach that to the needles they're bringing in. Dominique records the new needle number that's going out to them with their code name. We send these to Yale at the end of the day, and what they do, they look under the code name, today's date, and all that, and they can see if from their previous records, if they've been sharing, if they're handing in their needles or someone else's, things like that.
When the program began, we collected 600 or 700 street needles and tested many of those. Those needles led us to speculate that the prevalence of HIV in the population was higher than had previously been estimated. Of those street needles, somewhere on the order of about 70% were positive, suggesting that somewhere on the order of 60% of the people who had enrolled in the program were HIV positive. As the program has gone on, the number of positive needles has dropped somewhat. One of the ways this program works to decrease the spread of AIDS is by decreasing the number of infectious needles that are out there.
At least 90% of people I know, they have the virus, but they've never been tested. They're scared to go to the hospital or whatever, you know.
The thing about the needle exchange program is not only giving them a needle and having them go out and don't share and clean your needles. I think the very important thing about the needle exchange program is that we're able to help them get into treatment. See, addicts don't normally go out and seek help. You know, you really have to go out there and get them, and by doing the needle exchange, we get to talk to them, we get to offer them different treatments, and we've seen a lot of change in people.
The evaluation study shows that we are already reducing, or an estimated 33% of new infections, new HIV infections among the people who are using the program, which is a pretty remarkable accomplishment in less than 1 year. We also clearly are proving to be a bridge to drug treatment. We have 200 people who've asked us for help into treatment, and over 100 are now in treatment programs.
If you take a look at the demographics of people who are in drug treatment programs in the state of Connecticut and in New Haven County, what you discover is that the largest group represented, for example, are white men, and you discover that the level of infection among people currently in drug treatment seems to test out between 8 and 12%. The participants in the needle exchange are predominantly non-white. The level of infection is much, much higher. We're clearly reaching a population that the drug treatment programs were not able to reach on their own, and it makes sense. We're a mobile program. The van goes to areas in the city where the drug users actually live. They're not required to come in. We go to them.
Well, I think a lot of people feel like they've been betrayed when they went for services. It was always, most of the time, a situation where they had to go someplace, you know. And as outreach, you go directly to the people. You go where they live and where they function.
I think in terms of this program, it's really beautiful, and you know, I wish it was out here like 10 years ago. I think a lot more people would be alive.
I'd like to see the federal government change its current policy of prohibiting funding of needle exchange programs, and I'd like to see our leaders take a stronger position on the importance of clean needle access in the face of AIDS.
Even as imperfect as all of the evidence is that has been garnered, not just from our studies, but from the fine studies that came about before in San Francisco and Amsterdam and Vancouver, Canada, there's just never, to my knowledge, been a study where the main conclusion of the study was needle exchange does not work and actually causes harm. I see no science coming from the opposite side in this debate, and it's discouraging to me that rhetoric seems to have won today thus far at the national level.